Hello friends, in this video we are going to discuss about pineal gland tumors. The most common pineal gland tumor is extragonadal germ cell tumor, and this will have histopathology similar to the testicular seminoma. Before going into the clinical features of pineal gland tumors, we need to understand a little bit about the anatomy of pineal gland. So pineal gland is present at the posterior end of the thalamus, as you can see here. And it is also present at the upper posterior part of the midbrain. So this is the midbrain, and it is present at the upper posterior part of the midbrain. Now, if there is a tumor in the pineal gland, it can come forward and it can actually occlude the cerebral aqueduct of Sylvius. So this is the cerebral aqueduct which is connecting the third and fourth ventricle. So if the pineal gland occlude this aqueduct, it can cause obstructive or non-communicating hydrocephalus. Okay. So pineal gland tumors can cause obstructive hydrocephalus. At the same time, they can also cause something known as dorsal midbrain syndrome, because these are present at the dorsal aspect of the midbrain. So they can compress the midbrain posteriorly and it can cause dorsal midbrain syndrome. So these are the two clinical features, obstructive hydrocephalus and dorsal midbrain syndrome, which is otherwise known as Parinaud syndrome. As you can see in this image, the patient is having hydrocephalus. And now we'll discuss the components of Parinaud syndrome. So there are three important components. The first one is upward gaze palsy. Upward gaze palsy. This is because of the involvement of superior colliculus in the dorsal aspect of the midbrain. The patient will be unable to look upwards, and there will be upper lid retraction. As you can see here, there is upper lid retraction, and the patient is having a predominant downward gaze. This upper lid retraction is otherwise known as Collier's sign. It is known as Collier's sign. The second component is they will have convergence. Convergence, retraction, nystagmus. So this is the characteristic nystagmus that is described in patients with Parinaud syndrome. That means if the patient will try to look upwards, the eyeballs will converge and they will be retracted inwards. So that is known as convergence, retraction, nystagmus. The third component is light near dissociation. Light near dissociation. That means here the light reflex is absent, but accommodation reflex is present. Accommodation reflex is present. So light reflex is absent, accommodation reflex is present. This is known as light near dissociation. Now we need to understand the reason behind light near dissociation. So if you see, this is the light reflex pathway. So light reflex pathway starts from the exposure to the light. The signals from the retina will go through the optic nerves. Then there will be optic chiasm, then there will be optic tract. And some of these fibers will go on to supply the pretectal nucleus in the dorsal midbrain. Okay, so these are the pretectal nucleus. So this is the afferent pathway of the light reflex pathway. Now this pretectal nucleus will give signal to the Edinger-Westphal nucleus. So this is the Edinger-Westphal nucleus, which will have parasympathetic output through the oculomotor nerve or the third cranial nerve. Okay, as you can see here, this is the oculomotor nerve. So output from the Edinger-Westphal nucleus will go through the oculomotor nerve to supply the parasympathetic ciliary ganglion, and ultimately it will supply the sphincter pupillae muscles. And this entire thing comprises of the output pathway or efferent pathway for the light reflex. Okay, for light reflex, we have two components. One is the afferent pathway, and second one is the efferent pathway. Afferent pathway ends in the pretectal nucleus. Efferent pathway will start from the Edinger-Westphal nucleus. But remember, for accommodation reflex, accommodation can happen voluntarily. For accommodation reflex, you may not need a afferent pathway. You just need a functional Edinger-Westphal nucleus that will cause your constriction or dilatation of the pupil required for accommodation. Okay, so for accommodation reflex, you don't need a afferent pathway. You don't need the pretectal nucleus. But for light reflex pathway, you need the pretectal nucleus. And what happens in dorsal midbrain syndrome? your pretectal nucleus. So this is the dorsal part of the midbrain. So the dorsal part of the midbrain is damaged. So the pretectal nucleus is actually damaged in dorsal midbrain syndrome. That's why the light reflex pathway is affected. However, the accommodation reflex is present. So this is known as light near dissociation, and this is classically seen in dorsal midbrain syndrome or the Parinaud syndrome. So that's all about the pineal gland tumors and the Parinaud syndrome. Thank you.